as we promised, Dr. Susan Van Dyke is back. We're going to be doing a treatment on my hands. Now, this is a laser treatment that you do in the office?
Yes, it is. This is called a Fraxel.
Okay, what does this do for us?
This is my favorite laser right now, and it is a resurfacing laser that uses little microscopic beams of laser to treat a hand. Now, I'm putting my gloves on because I'm going to put a little tracking gel on your hand because we're going to simulate a treatment now. Now, of course, Tanya has beautiful hands. There's no brown spots. But what we would want to achieve with the treatment on you is maybe to improve the texture and the thickness.
Yes.
So give you a little more youthful look to it.
Now, this machine is just for hands?
This machine can be used on any part of the body.
Oh, okay.
Now, we could treat any part of the body, but I thought hand would be convenient.
Oh, okay.
So what we're going to do first is we're going to, as you see.
Oh, I see. It can be face, neck, arms.
Exactly.
Chest,
so
the sun damage on someone's chest?
Sun damage on the chest. And what's not on here is belly. You can do stretch marks on an abdomen. We're actually doing a study right now on women with stretch marks after babies.
Okay.
So you can do mostly face, neck, and chest is most popular, then hands, but also arms.
Does it really alleviate the stretch marks? It takes them away?
It really improves them, yes. We're actually doing a significant study on looking at the degree to which it works.
So it eliminates all stretch marks on you?
I never say eliminate anything.
Okay.
It makes things better.
Okay.
So hand, please. We're going to measure the length of your hand. Now, in case you ever wanted to know what the square footage of your hand was, I'm going to tell you. So that's the length. And what this is going to tell the machine is how much energy we're going to be using if we were officially treating you. So you have 56 square centimeters on the hand.
Okay. I've always wanted to know that.
Didn't you want to know?
They ask that on all the forms I fill out.
And so now I can change the settings, of which there are many different settings depending on what we're trying to do, face, neck, chest. If we're treating deep acne scars, we'll go with a deeper level.
Okay.
And if we're treating superficial brown spots, we'll do a more superficial level. So I can predetermine how deep the laser beams will go in the skin.
Now, is this a treatment like walk in the office, sit down, have it done, and you can go back to work?
Yes. Now, there is redness and puffiness that follows this treatment. So if we're doing a face, I usually suggest doing it on a Friday.
Okay.
All right. So now it says it's ready. We're in simulate now. If we were actually doing the treatment, we would be wearing safety glasses, and you would feel a little pinching, but you won't really feel anything. And what's happening is these little tiny laser beams.
It feels warm.
You're feeling the guiding light there.
Okay.
But it would feel a little bit hot and pinchy. Like
it does.
Millions of little tiny, little tiny fine lines. That's exactly what it feels like. Yep. Now, if I turned it up, we could make it.
Oh, don't turn it up.
No, we won't. So I would cover the whole hand, and what it's doing is because the laser are tiny pinpoints, I'll go over and over the area. And when I'm done, only 20% of the entire skin is actually treated. So that means 80% of the skin is left normal. So it heals very, very quickly. So the end result would be this would just be pink. It would be a little puffy, and you'll get some flaking after a few days. The treatment would be repeated probably 3 or 4 times to get a result.
So by 80% remaining normal, that's what's doing the healing process and speeding the healing process up. Now, you leave 80% on the entire body, whatever part of the body you do?
Yes, I can adjust it anywhere from 10, 20% at a time of treated area.
Okay.
So if I was treating someone with very dark skin, and you can treat black skin with this also, I would use a treatment setting that is only going to treat about 10% of the surface area, and then I would do more treatments. So what actually the benefit is that the surface skin is left fairly undisturbed, so it heals quickly. But the laser goes so deep in the skin, we get heat very deep in the collagen layer. Collagen is where it's like the leather part of the skin. That's where your wrinkles are. So if we can make your body make new collagen, what you'll see is the skin will get healthier and firmer and thicker.
Now see, I'm a little pink. I'm supposed to be a little pink.
Exactly.
Now, let's talk about Botox and the treatments that every woman wants to know about. Every woman walks in your office and wants to know about. Laser we can do on any part of the body.
Laser,
now this is for
some lasers.
Okay, some lasers. Okay, laser will treat what now in particular again?
You know, lasers there are hundreds of them, and they treat many, many different things. This particular laser is a resurfacing, so it will treat precancers, sun damage, brown spots, things that are on the surface of the skin, stretch marks, things you can see.
Okay.
You would use a different laser to treat a tattoo, for instance.
Okay, now what about Botox? It treats?
Botox treats movement, wrinkles caused by movement. So any muscle you inject it into, it's going to relax. So cosmetically, you know, loose forehead, I would love to get a hold of. And crow's feet and between the eyebrows are ideal places for use of Botox.
Okay, like collagen and perlane and the injectables.
Those are called fillers.
The soft fillers.
Yeah, now fillers correct wrinkles by taking up space. So if you have at rest, someone here earlier asked me about some grooves near the mouth. If you have a wrinkle at rest that would benefit by filling up, that's where fillers come in.
And fillers typically stay how long in the skin?
Now a year. They used to be 3 months, but now we're getting a year. And we're also treating some really interesting areas because aging has to do with loss of volume. If we put volume back in the face, we can make the skin look more youthful.
I'm so glad we've gotten to that point because years ago, my generation and probably some of your generation, we thought about facelifts.
Yes,
they stretch the skin back.
Right.
But to look youthful, you want to get that plumpness back into the skin, that baby fat that we lose.
Perfect, exactly. I just did a lecture this weekend and I put a picture of a fat baby next to a picture of a 70-year-old woman, and the difference between the two is that one's deflated and one isn't.
And the point being that someday will we see a soft tissue filler that would be somewhat permanent? Because we're looking at a year now.
We don't want permanent.
Want that? Why don't we want that?
Because you will change over time. Your body will change. The bone structures change as you get older. The fat pads move around. So it's much better to have something that will last a year or two, and you keep tailoring it to the appearance of the person.
Interesting. I never thought of it that way.
We don't want to give you 20-year-old cheeks. It would.
Oh, I don't know. I'd like to have 20-year-old cheeks.
Well, we'll try that then.
Dr. Van Dyke, thank you so much for being here. And we'll talk to you next time up here.
You bet. My pleasure.
When we come back, we're in the kitchen with Jan Taubman. You stay there.